Good morning, everyone. My name is Kathy Hudson. I'm the Deputy Director for Science, Outreach, and Policy here at the National Institutes of Health. Thank you so much for coming, and a particular hat tip to those of you who managed to get here from Boston. Way to go. As you all know, the President announced in the State of the Union on January 20th that he was making a commitment to an initiative in precision medicine. 10 days later, he said more about that in an event at the White House that some of us were fortunate enough to attend. In his budget proposal for fiscal year 2016, which begins October 1st, he has proposed $130 million to be used to build a research cohort of 1 million or more Americans in order to examine the molecular, lifestyle, behavioral, and other inputs and contributions to health and disease. So we really just have only the barest framework for this initiative, and what we're going to be doing between now and October 1st is really building a detailed plan for what this precision medicine cohort is going to look like. And so that's why we've called on you, and will be calling on many others of varied expertise and insight over the course of the next weeks and months to really get your input and expertise and insights to help us build a detailed plan for how we move forward with this precision medicine cohort. So this is the first of many, many conversations that we're going to be having. We absolutely want to have a gathering of patients and members of the public in order to get their insights early on. As Francis has said many times, this is going to be a partnership, and we want to build that partnership from the very beginning. There's a number of patient representatives and members of the public who are with us today and joining from on the web, but we really want to start that partnership at the get-go. In addition, we're not starting this research cohort from scratch. We're building on a number of cohorts that already exist, and leaders of some of those cohorts are with us today, but we will have to reach out and have conversations and collect insights and input from many, many cohort leaders and coordinators, and so we'll be having a convening of the leaders of those cohorts soon as well. And I'm sure over the course of the next 2 days, today and tomorrow, we'll have many other ideas about the kinds of conversations that we'll need to have and the kinds of expertise that we'll need to tap into as we move forward. So in addition to those conversations with many people from outside, we're also going to be putting together a working group of the advisory committee to the NIH director. That mechanism has been used to guide the formation of a number of really important initiatives at NIH over the last several years. We had a working group to the advisory committee to the director that helped formulate the plans for the National Center for Advancing Translational Sciences. We had a working group of the NIH advisory committee that helped lay out the plan for the BRAIN initiative, a very ambitious dozen-year plan for science to understand the circuits of the brain. And now we're going to be putting together a working group of the advisory committee to the director to really shape what this looks like and get the best and brightest folks around a table to work really hard to do that. And Dr. Collins has named the co-chairs for that group. Dr. Rick Lifton, who's here in the front row, and myself will be co-chairing that group, and we'll be naming members of that in the coming days and weeks. If you know of folks who would be outstanding to serve on such a group, please send their names my way. I'm easy to find on email. Before I turn this over to Eric, I want to do a shout out to the people who have helped pull this meeting together. There's a group of about 20 people from across the different institutes and centers at the NIH who have worked really tirelessly to put this plan together, this framework for a plan together, and pull today together. And I really want to give a hat tip to everybody, and especially to the ladies sitting here behind me, Allison and Stephanie, who have really been leading the charge for us. And then I want to turn it over to my partner in crime, Eric Green.